Okay, when palpating the temporomandibular joint or the TM joint, we can start here. We'll start with our hands posterior here behind the mastoid process, which is here. Okay. I'm going to start off the mastoid process directly posterior to the ear. We're going to track our fingers anteriorly to the next bone we feel here, the bottom of the jaw, which is the mandible. And we can track that around. All of this is mandible. Okay. Next, if we want to go to the TM joint itself, it's typically directly in line with the external auditory meatus. Just go just anterior to that. I like to put my fingers on both sides at the same time so I can get an assessment. And I'm going to feel for a ridging, which would be the condylar process here of the mandible. And that feels like that ridge there. And then I'm going to go superior, and I should feel a little bit of a divot, which would be the joint. I feel like I went too high here. That feels like it's that there, or maybe here. So next I'm going to have the patient open their jaw, good, and then close, good. Open again, and close, good. So when I move superior right here, I don't feel any movement, so I'm too high. I'm not on the joint. I'm going to come inferior again, go ahead and open again. Good, now I feel the mandible move, and I feel a space created under my finger here. So I know that I'm over the joint space. So right here is the temporomandibular joint on the left, confirmed by him opening and closing his jaw. Next, I'm going to move to the zygomatic arch. So I'm going to move anteriorly, and I'll be right here. It is this bony prominence arching here. If I go inferior to that, this is more muscle, bone. This is bone as well, but this is more temporalis, and then the temple, and the temporalis muscle right here. Zygomatic arch here comes across. Zygomatic arch. Masseter muscle. If I come inferior to the zygomatic arch, coming off the mandible here, it's going to run vertical like so. It's our main muscle of mastication and clenching or closing the mandible. So I would feel that it's right here. I'll have the patient clench their teeth. Go ahead and clench. Good. And I should feel it firm up right there, which it does. Up to the zygomatic arch and down. And it slings around. Go ahead and relax. So here's your masseter muscle. Frontalis is along the forehead here. This muscle here for furrowing their brow. This area, especially if someone has a TMJ dysfunction, this area gets really tight and stressed out. Tonic. This helps calm down some headaches caused by TM joint dysfunction. Lateral and medial pterygoid muscles. Those are actually intraorally as well as extraorally. So we'll be doing that intraorally in a moment. But for the lateral pterygoid, extraorally or outside, we're going to go to the zygomatic arch. I'm going to go inferior to the zygomatic arch, but anterior to the masseter, which is here. I'm going to go right here. And then I'm trying to go deep to the zygomatic arch under there. So it'll be right here. I'm not going to push too hard, but that would be the lateral pterygoid. And if the patient opens their jaw, go ahead and open. There we go. I should feel that kind of push my finger out and relax. Good. Lateral pterygoid helps to bring the mandible forward when you're depressing the jaw. That's why I can feel it with depression. Anterior belly of digastric. If I come extraorally, it's going to be underneath here, following the angle of the mandible. If I got right here, I could feel that one there and there. That's it. If you go ahead and open your jaw, and then I resist, I can feel, if I resist his chin, I can feel digastric kicking in there. Good, and relax. So anterior belly of digastric, posterior belly of digastric, back here, deep underneath the mandible. I'm going to feel here, right there. For posterior belly of digastric, if I have the patient swallow, go ahead and swallow. I should feel that muscle kick in. Intraorally, real quick. Are you okay if I use a gloved digit to go into the jaw?
Yeah, that's
Good. I'm going to use a glove hand here. Make sure that when you put your gloves on, that you don't touch anything else. Don't touch your clothes, don't touch yourself, don't touch anything else once the glove is on, especially if you're going in the person's mouth. And be really overt that your hands are gloved and they're clean and you're not touching anything for the patient, okay? Then I'm just gonna ask, let's go ahead and just, can you turn to your left a little bit? Perfect. And then from there, what I'd like to do is go ahead and just open your jaw there. Good. And if I'm going for medial pterygoid, it is basically the same thing as the masseter muscle, but on the intraoral side, like this, and they're like a sling. So masseter here, medial pterygoid here. They both have an M start, so I like to think the M and the M's go together if I'm trying to differentiate between lateral and medial. So medial pterygoid here, nice and vertical. I'm gonna go in, trying to get to the back, the retromost point of the mouth, and at the end of the molars, all the way back here, right there. So after the molars, the most stringy point here on the lateral side, that it's really, really, really firm because it's a constant chewer. So it's gonna feel almost like bone. So feel that there, that's not bone, that's actually a muscle right there. It's your medial pterygoid, okay? Same thing if I were to go right there, that's it right there. Pretty tight, yeah?
Yeah.
The strong one. So if you look at a picture of a Tyrannosaurus Rex with its mouth open, right here, these are his medial pterygoids. They don't have masseters, so it's a medial pterygoid. So if you look at a T-Rex, that's that, okay? If I wanted to now do lateral pterygoid, this one is a little tougher and a little more uncomfortable for the patient, so just be real gentle with it. We're going to go ahead and relax for a moment, please. We didn't tell you, but right here, maxilla, okay? So I actually want to try and go on the anterior surface of the maxilla, slide my finger back to try and go inferior to the zygomatic arch. Basically, I'm trying to go straight to where the TM joint sits, along the maxilla here and along the upper dental area. So go ahead and open up for me, please. I'm gonna just gently get in on top of the maxilla like that, under the lip, and then you just relax. I'm just gonna go straight back, right there. Feel that guy? That is your lateral pterygoid. And if you open a little bit, good, I can feel that push into my finger and relax, good. So when the patient opens their jaw, you'll feel the muscle push into your finger a little bit. So there's lateral pterygoid intraorally. Okay, for the suboccipital muscles of the cervical spine, the upper cervical spine, we'll start with rectus capitis posterior major. We're going to start at the spinous process of C2. So again, we'd find that by going to the occiput here, going down. Here would be my C1. My very next inferior would be C2, that bifurcated spinous process, and I can feel that it's bifurcated there. So C2 spinous, over to the occipital bone. So occipital bone here, or the occiput, okay, just like that. So this would be rectus capitis posterior major, right there. Rectus capitis posterior minor would be from the posterior arch of C1. So I go up to C1, over to the same spot of the occiput. Same thing, just going across there instead of there. So right here, rectus capitis posterior minor. Obliquus capitis superior, be from the transverse process of C1. So transverse process of C1, come out behind the mastoid process, just inferior and posterior to that. C1 right there. So there's my transverse process of C1, or my atlas, and then up to the occiput, so to here. So I'm gonna feel that guy. So there is oblique capitis superior. And then inferior is from the spine, posterior spine here, to the axis vertebrae of the transverse process. So here to here, down this way. So there's your obliquus capitis inferior. So your suboccipital triangle muscles there.